Hi, I am Dr. Selvaraj, your surgical educator from Malaysia. Welcome back to my series of surgical teaching videocasts. These are meant mainly for undergraduate medical students doing the surgical clerkship rotation. I promise you will become competent in clinical problem solving and surgical decision making if you are going to watch these videos over and over again. Today, in this episode, I am going to continue the MCQs on the various surgical conditions. So, I was discussing the groin swelling. Yeah, the last video was on inguinal hernia. So today we are going to discuss 10 MCQs on femoral hernia. So I need not emphasize the importance of MCQs to the present day medical students because you are all appearing for MCQ exam both in your qualifying exams like MBBS, MS, MRCS, and etc., as well as in all international competitive medical entrance exams like NEET PG, NEET SS, USMLE, UK MLA. So, all these exams are using nowadays for assessment mainly exclusively only MCQs. So, I need not emphasize the importance of how to answer MCQs in your exams. So these series of videos will give you a systematic way of revising the whole spectrum of general surgery, topic by topic I am going to discuss. So in this episode, I'll be discussing 10 MCQs exclusively only from femoral hernia. But before going to discuss these 10 MCQs, I want you to go and watch my video in my YouTube channel, that is the Surgical Educator YouTube channel on femoral hernia. Please click this link, go and watch this video, learn everything thoroughly, and then you come back for discussing these MCQs. So this is the mind map for femoral hernia. I am including the mind maps also because mind map is a very powerful, teaching tool. Whatever I am teaching in the whole video, all the important facts are there in the the single page. So here you see I am discussing about the etiology, special types and clinical features, treatment and post-op complication of femoral hernia. So all these things you can pause the video, you can go through it thoroughly. So coming to MCQ number 1, a 65-year-old obese woman present with persistent vomiting, abdominal distension and a painful lump in her left groin. The lump is below and lateral to the pubic tubercle, irreducible and tender. What is the most likely diagnosis? A. Indirect inguinal hernia. B. Femoral hernia. C. Lipoma of the spermatic cord. And D. Inguinal lymphadenitis. Of course, the correct answer is B. Femoral hernia because the hallmark is the location. That is the main thing. It is below and lateral to the pubic tubercle, so it is a femoral hernia. Femoral hernia are more common in elderly women, that is also there, and present with complications like obstruction and strangulation. Here it looks like irreducible and tender also, so it is already strangulated, so it is a Richter's hernia. Reference is from the famous Bailey and Love, 28th edition. Coming to MCQ number 2, an elderly woman present with signs of intestinal obstruction and a tender lump in the right groin. The lump is irreducible and shows signs of skin changes, erythema and all. What is the best next step you will take? A. Ultrasound scan. B. Elective hernia repair. C. Emergency hernia repair or herniatomy. D. CT abdomen and pelvis. The correct answer is C, the emergency herniatomy or emergency surgery. Explanation: the case scenario is showing it is a strangulated femoral hernia, that is the richest one, present with obstruction, and already skin changes are also there. That requires emergency surgery. So you need not do CT abdominal or ultrasound to prove that it is a hernia. So straight away you take the patient to the theater and you operate. That is the next step you have to take. Reference is from S. Das, a concise textbook of surgery, 10th edition. I am giving all these references in the reference separately in one page. I'll be giving it so you can see that also there. Coming to MCQ number 3, a female patient present with an irreducible groin swelling associated with high-pitched bowel sounds and tenderness. High-pitched bowel sound means it is early obstruction, not late obstruction. What is the most feared complication? A. Urinary obstruction. B. Testicular torsion. C. Intestinal perforation. D. Strangulation. The correct answer is D. Strangulation. Femoral hernia have a narrow neck, predisposing to strangulation even when it is very small. So that is the most feared complication, strangulation. Female patient, because the neck is very narrow, okay, it can go for strangulation. First obstruction, and then if you are not going to, intervene, it will definitely go for strangulation. And then it may even get perforated. That is the next thing, intestinal perforation. So the femoral hernia have a very narrow neck, predisposing the strangulation even when it is very small. Reference is from the Sebastian textbook of surgery, 21st edition. Coming to MCQ number 4, a 55-year-old woman undergoes surgery for a groin hernia found to lie posterior to the femoral vessels. What type of femoral hernia is this? A. Longus hernia. B. Seraphinis hernia. C. Larus hernia. And D. Clockwork's hernia. The correct answer is B. Seraphinis hernia. Seraphinis hernia is a rare type located posterior to the femoral vessels, both to the femoral artery and femoral vein. It will be lying posterior to that, that is Seraphinis hernia. Reference is from Skandalski's Surgical Anatomy and Technique. This is on femoral hernias. Coming to MCQ number 5. During hernia surgery, a sag is found passing through the lacunar ligament. What type of femoral hernia is this? A. Clockwork's hernia. B. Longus hernia. C. Littri's hernia. D. Hamayan's hernia. So the correct answer is Longus hernia, B. Explanation: Longus hernia protrudes through the lacunar ligament, a very rare femoral hernia variant. Reference is from Nigus and Content's hernia textbook, 5th edition. Anatomy and classification of groin hernias. See, in that you can see this. Coming to MCQ number 6. The 60-year-old obese woman with a groin hernia is planned for elective repair. The hernia is reducible and there are no signs of obstruction. Which surgical approach is most appropriate? A. McEvidy's high approach, Lockwood's infrainguinal approach, Lothusian's transinguinal approach, and then midline laparotomy, D. The correct answer is B. Lockwood's infrainguinal approach, because Lockwood's low approach is preferred for elective uncomplicated femoral hernia repairs. Okay, you can see it from below and you can reduce the hernia and then you can close the femoral ring also, surgery. So reference is from Fitzgibbons Hernia, Surgical Clinic of North America, one of the, um, volumes. So it is the Lockwood's law approach. Details is there in that particular reference. Coming to MCQ 7, a 70-year-old woman with bowel obstruction is diagnosed with a strangulated femoral hernia. Which surgical approach offers best exposure for bowel resection? A. McEvidy's high approach. B. Lothian's transinguinal approach. C. Lockwood's infrainguinal approach. And D. Laparoscopic transabdominal preperitoneal approach. The correct answer is A. McEvidy's high approach, because McEvidy's approach gives direct access to the peritoneal cavity, especially for strangulated hernias. This is the best approach. McEvidy's high approach. Reference is from the Swartz Principles of Surgery, 11th edition. Coming to MCQ number 8. Which of the following forms the medial boundary of the femoral canal? A. Femoral vein. B. Inguinal ligament. C. Lacunar ligament. And D. Pectineal ligament. The correct answer is C. Lacunar ligament. Explanation: the femoral canal is bounded medially by the lacunar ligament and laterally by the femoral vein, anteriorly by inguinal ligament and posteriorly by the pectineal ligament. So, the correct answer is only lacunar ligament. The reference is from Gray's Anatomy, 41st edition. Coming to MCQ number 9, which side is more commonly affected by femoral hernia? A. Left. B. Right. C. Equally. And D. Bilaterally. The correct answer is B. The right side. The femoral hernias are more frequent on the right side because it is due to delayed, involution of the processus vaginalis, and another cause is the presence of sigmoid colon on the left side, so it is uncommon on the left side. Okay, these are the two reasons. Number one, the delayed involution of processes, that is one cause. The another important cause is presence of sigmoid colon on the left side, and that is why it is not common in that side, it's more common on the right side. Reference is again from Bailey and Lau, 28th edition. Coming to the last MCQ number 10, which one of the following is a femoral hernia containing Meckel's diverticulum? A. Littri's hernia. B. Amiens hernia. C. Richter's hernia. D. Logius hernia. Of course, the correct answer is A. Littri's hernia. Littri's hernia refers to presence of Meckel's diverticulum in the hernial sac, which may occur at various sites, including femoral hernia. Even in inguinal hernia, it could be a Littri's hernia. If the content is Meckel's diverticulum, that is called Littri's hernia, irrespective of whether it is inguinal or femoral, doesn't matter. Reference is again the Scandalakis, the Modern Hernia Repair book. So these are the reference books. All these books are either problem oriented. The first two books are problem oriented books. I think only 3 books are there in the literature. Number one is Hunt and Marshall's Clinical Problems in Surgery. So the teaching is not disease oriented or system oriented. It is problem oriented book, Hunt and Marshall's. And another book is Clinical Surgery Made Easy by the Mohan D. Silva, 2nd edition. This is also excellent book. And another one is Learning General Surgery is another book, problem oriented book. All other books are case based book, like 100 cases in general surgery, that is 2nd edition, case files in surgery, 5th edition, clinical scenarios in surgery and decision making, 2nd edition, surgery, a case based clinical review, 2nd edition, by Christian D. Virgilio, and Surgery Review by Carlos Pestana, Clinical Surgery Pulse by Professor Dr. Dayananda Babu, 3rd edition, NMS Casebook Surgery, 2nd edition, Journal Surgery Correlation and Clinical Scenarios, 1st edition, Surgery Review by Macari, 3rd edition, Surgery Clinical Cases Uncovered by Harold Ellis, and Self-Life Surgery is a MCQ book actually. So all other books are case-based scenarios. You have to, of course, the best reference books are Bailey and Love and Sebastian. You have to read, but nowadays they are going to ask everything, all MCQs, almost more than 90% of your MCQs are going to be only case-based. So apart from reading Bailey and Love and Sebastian, I recommend all of you to see these case-based scenarios with MCQ in these books, learn them so that it will be very easy for you to answer or to appear these case-based scenario-based MCQs. And here I am giving you a link. You can click it. I will be giving it in description also. This video I am explaining and I am talking about the various textbooks available for general surgery. So I am extensively discussing about the various surgical books available today for making of a surgeon. So this is another book. I have created this book exclusively only for my students' use. Okay, this is a clinical case discussion in general surgery. This book you can download freely from this link. This I am giving it in the description also. You can click it and you can download this book. This book contains 9 modules, more than 120 case scenarios, and the same thing I am discussing as a playlist in my videos. 9 modules, 9 videos are there. You can click to view that playlist of videos in my YouTube channel. You can click this also. You can just watch those videos also to learn the case scenario, because case scenarios or image based questions are very important nowadays. So you should know, you should practice even before the exam. You should practice this case based scenario based MCQ. Then only you can confidently appear for the actual NEET PG or NEET SS exams. So thank you very much for watching this video. If you think that these videos are very helpful, kindly share these videos in your social media. Kindly click the bell button also to get notified regarding my latest uploads. Thank you once again for watching this video. Let us meet in yet another episode. Until then, bye bye.